Hey, welcome to Socialism for All. Today's date is June 2nd, 2025, and a few days ago on Thursday, we recorded S4A live stream number 128 on Twitch at twitch.tv/socialismS4A. And that stream went pretty long, and one of the sections that I'd prepared for it we weren't able to get to. So basically this video is a supplement to that one, which hopefully will be edited and posted by the end of this week. The subject of this video is COVID. Here's your COVID update for May and early June 2025. If you like this video, please click like and subscribe, and consider supporting on Patreon or buy me a coffee at patreon.com/socialismforall or buymeacoffee.com/socialismforall. There are links to Patreon and buy me a coffee in the video description. So there are a number of stories that I want to cover related to the ongoing COVID-19 pandemic. And it is ongoing, although fewer people are dying now than were a few years ago in the very early stage. That doesn't mean that COVID isn't harmful. It means that many of the most vulnerable people are already dead, something which the back-to-normal zombie cult has not really coped with or grieved. So it's just a fact lingering unresolved. But beyond that, the threat of COVID is not just death. It can do all kinds of damage in your body, including to your brain, heart, blood vessels, immune system, really any tissue which has ACE2 receptors, which is how the virus gains access for the most part into your cells. And that includes basically all of your major organs, including the liver and digestive system and kidneys, etc. It can increase your risk of diabetes, especially if you're younger. It can cause damage to your brain via inflammation, which can make worse any existing cognitive and or emotional problems you may have or cause new ones. It can also attack the brainstem, causing something called dysautonomia, which dysregulates the systems of your body which are not under your conscious control, such as heartbeat, breathing, and so on. And we're going to read some articles about that. Really, the list of damage that it can cause potentially in your body is very long. And for the people out there saying, oh, I've gotten COVID 5 or 6 times and I'm still alive. Yeah, but it's probably taken a huge toll on your body. It's unclear at this point, because it is a new or novel virus, how many years off of your life the typical COVID infection will shave, but we know that even seemingly mild infections, where you get it and in the first few weeks you don't have too many symptoms, it can still cause massive inflammation, which basically ages your tissues. And again, you just don't need that. We all are going to leave this earth at some point, but your quality of life is important, your longevity is important, and you need to protect your health. It's the basis of your survival, without which you simply cease to exist. And we mentioned a number of major organs so far. How about the lungs? That's one of COVID's main targets. There's a lot of people out there who have quit smoking, especially in the last 20-25 years as indoor smoking bans have become more common. And that's a great thing. You want to protect your lungs. You need your lungs every few seconds as you breathe. And it's great for those who have quit smoking one way or another that you've stopped damaging your lungs that way. But repeatedly allowing yourself to get infected with COVID is causing just as much damage, maybe more. Now, it is difficult. There's a lot of cultural factors here which are trying to bury any notion of the pandemic. People sometimes get triggered just by seeing somebody wearing a mask, but we have to protect ourselves and protect each other. So plan A, wear a mask, N95 or better. And plan B, for most people, in case of a mask failure, stay up to date on the vaccines. Now, they're trying to remove access to the vaccines. We're going to cover that later in this segment. And it's not just the mRNA newer type of vaccine, it's also the classic protein type of vaccine. In the US, that means Novavax. Actually, this administration is subjecting the Novavax to additional scrutiny and making them do extra testing and jump through additional hoops. So they're actually making it harder for people who want to get the vaccine to get a non-mRNA vaccine than to get the newer mRNA type, although there's nothing wrong with the mRNA either. The right wing has simply chosen to politicize this topic to an extreme level, basically to sow chaos. More on that later. Right now, let's turn to the new strain of COVID that has arisen, NB.1.8.1, commonly known as razor blade throat due to its symptoms. We have a few articles on that. Let's begin with an article from The Independent. Headline, New COVID variant spreading from Asia now surges across US, what it is and where it's spreading. The spread of NB.1.8.1 comes after the Trump administration announced a plan to limit access to COVID vaccines. This was written by Julia Musto, Wednesday, 28 May, so very recent. The new COVID variant is continuing to proliferate around the US, although you might not know it just by checking federal variant tracking dashboards. Known as NB.1.8.1, the Omicron variant has been tracked in states across the country following a large surge in China. Although right now LP.8.1, a descendant of JN.1, is still the nation's dominant strain. The Centers for Disease Control, or the Centers for Disease as we call them, is in regular contact with international partners and is aware of reported NB.1.8.1 cases in China, an agency spokesperson told The Independent. There have been too few U.S. sequences reported thus far for the variant to be included in its dashboard. But in Asia, it's resulted in increased hospitalizations and emergency room visits, so here's what to know. It has been designated as a SARS coronavirus 2 variant under monitoring, with increasing proportions globally according to the WHO. There are currently 6, which are tracked by the agency. It has spread through 22 countries, and in the U.S. it's been traced to New York, California, Arizona, Ohio, and Rhode Island, according to records from local health officials at the CDC's airport testing partner, Ginkgo Bioworks. While still low in numbers, the WHO noted that there had been a significant rise in its prevalence, or number of concurrent cases, from late March to April. What do we know about related infections? The public health risk posed by this variant is evaluated as low at the global level, although the goalposts on that at this point, I don't know what to say. Quoting the WHO, despite a concurrent increases in cases and hospitalizations in some countries where this variant is widespread, current data do not indicate that this variant leads to more severe illness than other variants in circulation. Unquote. Although, again, I would take that with a grain of salt. But while it may not be particularly severe, according to them, it may infect people more easily than previous variants, so it's more transmissible. People with it more contagious. There is some evidence that this variant binds more tightly to human cells. Quoting Subhash Verma, a professor of microbiology and immunology at the University of Nevada, Reno School of Medicine, data indicates that NB.1.8.1 does not lead to more severe illness compared to previous variants, although it appears to have a growth advantage, suggesting that it may spread more easily. In other words, it's more transmissible. Do the COVID vaccines work against NB.1.8.1? Yes, our currently approved COVID shots are expected to remain effective against this variant and to protect against severe disease, although commenting the efficacy of the shots generally has dropped significantly since they were first rolled out, and what they mean by severe disease is immediate death and hospitalization. So if that's your bar, then yeah, I guess it's kind of working. Although if you set your bar any higher in terms of the kinds of outcomes that you consider acceptable, then you're quite likely to be dissatisfied by the basically vaccine-only strategy that has been taken since right-wing Democratic President Joe Biden, whose COVID advisor Jeff Zients was a vulture capitalist with no experience in public health, declared Vax and Relax back in May 2021. Again, our position is that the vaccines are useful as a plan B in case of mask failure, but masking, preventing the spread, stopping infection at the source is really the main strategy that needs to be pursued, and the lack of political will to do this in the face of the business interests that didn't want to pursue such a quote-unquote disruptive route should be remembered as a major betrayal of the public health science surrounding SARS coronavirus 2, and a failure of the public health system of the US and other countries, which exposed the basic inadequacy of these systems under capitalism to protect public health and promote public wellness. And now the current administration is continuing that trend. Biden was already promoting a medically inadequate response to the pandemic, which gave the public conflicting information and did not adequately combat disinformation around vaccines, masking, and other topics, which led to increased public distrust in these basic, safe public health interventions and led to decreased interest and support in pursuing them. And now the Trump administration is picking up that trend where it left off, and they're continuing to hammer away at the public's ability to defend themselves, the few of us who actually are trying, in the midst of the environment created by all the disinformation and politicization of it. So continuing the article, access to the vaccines is being limited by the Trump administration. On Tuesday, health officials said that the COVID vaccine for healthy children and pregnant women had been removed from the CDC's recommended immunization schedule. So commenting, we're going to cover this in more detail, but that's not entirely accurate because the CDC hit back and said that's not totally true. But again, the net effect is chaos. Continuing, the Food and Drug Administration said last week that it will continue to approve updates for seniors and people with underlying medical conditions. However, it will require vaccine makers to conduct major new clinical trials before approving them for wider use. And let me just add here, 50% of children admitted to the intensive care unit for COVID did not have underlying conditions, so this is not medically supported. It is ideologically driven 100%. Continuing. Although the number of COVID-related hospitalizations and deaths has fallen considerably since the pandemic's start, experts worry about what limiting access to vaccines could do. Quote, is the pharmacist going to determine if you're in a high-risk group? Dr. Paul Offit, a vaccine expert at Children's Hospital of Philadelphia, told the Associated Press, quote, the only thing that can come of this is making vaccines less insurable and less available, unquote. For now, people can still get the shots. That's the end of the article, and for what it's worth, I would suggest looking into that. My understanding is this would apply to the next round of shots for the fall. They're updating the formula annually, which even in that case, it's not keeping up, because the virus mutates way faster than that. So by the time they come out with a shot, the virus has already mutated like 2 or 3 times, and the efficacy just doesn't hold up for a full 12 months. So people really should be getting shots more often than that. That's not really a practical strategy. So again, stopping the spread, much better strategy than the vaccine-only approach that the US has been taking. They haven't outright banned masks, although there has been that idea floated. And if they were to do that at this point, you wouldn't be able to get the shot either. So you'd be totally without protection. Just racking up damage in your body, infection after infection, nightmare scenario. The last time I personally got COVID, I got very sick. I had effects from it. I got long COVID for about a year. Those were at least the clear and obvious effects. I think I had immune effects for a couple of years afterward. And I think actually still my immune system isn't what it used to be. SARS coronavirus 2, as I mentioned before, can cause immune damage by infecting and killing T cells. The only other virus that does that, and they're not exactly the same, but the only other virus that just straight up infects and kills the T cells, which is a major pillar of your immune system to fight off infections and cancer cells, is HIV, which causes AIDS. All right, next article, we're going to read from the San Francisco Chronicle. Stanford scientists detect new COVID variant in California as U.S. moves to tighten vaccine access. This is dated May 27. A new and highly transmissible variant of the coronavirus known as NB.1.8.1 has been detected in California and several other U.S. states, prompting concern among public health experts as the federal government moves to restrict access to updated COVID-19 vaccines. First identified as a driving force behind a major surge in cases across China, the NB.1.8.1 variant has been reported in international travelers screened at airports in Washington, Virginia, New York, and California. In California, scientists at the Stanford Clinical Virology Laboratory confirmed the state's first known infection on April 17, according to data from the CDC. Experts said they were closely monitoring the variant, which is spreading rapidly across parts of Asia and Europe. In Hong Kong, health officials recently reported the highest levels of COVID-19 activity in at least a year, citing a, quote, significant increase in emergency room visits and hospitalizations. Quote, CDC is aware of reported cases of COVID-19 NB.1.8.1 in China and is in regular contact with international partners, the agency said in a statement last week to CBS News, which first reported the variant's detection in the U.S. In addition to airport screenings, local health departments have confirmed NB.1.8.1 cases in Ohio, Rhode Island, Hawaii, Washington, and California. Experts say the variant appears to be more contagious than previous strains, though not more severe. Symptoms are similar to earlier strains, including cough, sore throat, fever, and fatigue, commenting in the short term, and then in the long term, all kinds of organ damage. The emergence of NB.1.8.1 coincides with a controversial shift in vaccine policy under the Trump administration. Controversial being a coward's way of saying 100% certain to cause disability and disease. The Food and Drug Administration, now under leadership appointed by Health and Human Services Secretary Robert F. Kennedy Jr. and his brainworm, announced last week that updated COVID-19 vaccines this fall will be limited to seniors and people with certain medical conditions. Quote, the FDA will approve vaccines for high-risk persons, commenting which used to include people who were considered overweight, not just obese, which would include almost 80% of the population, although they've taken overweight off of the list that I saw. Continuing, and at the same time demand robust gold standard data on persons at low risk. No one is at low risk of COVID. No one. We don't know who's going to get long COVID. We don't know whose life is going to be destroyed by that. And we're talking about a disease that is as contagious as measles. Although, if you look at how they're handling measles, they don't seem to care about that either. Anyway, that's quoting from Dr. Vinay Prasad, the agency's vaccine division chief and a professor of epidemiology at UCSF. On Tuesday, Kennedy added that COVID-19 vaccines will no longer be recommended for healthy children and pregnant women, drawing sharp warnings from pediatricians over risks to the most vulnerable. Quote, "I couldn't be more pleased," Kennedy said of the decision in a video he posted on Twitter. I think this was after swimming in the fecally contaminated creek. We're living in such bizarre times. They're really rubbing it in our faces. But this is how it looks when capitalism dies and you haven't come up with something to replace it yet. We need a movement that can take monsters like this out of power, starting at the root, the capitalists who put them there in the first place, and to build socialism, actually worker-centered and not profit-oriented, so that we can actually have a future. Continuing the article, while officials say up to 200 million Americans will still qualify, many health experts warn that the policy could leave large portions of the population unprotected. During an FDA advisory panel meeting last week, outside vaccine experts discussed the implications of NB.1.8.1 and strategies for the upcoming vaccine rollout. Last season's shots targeted the KP2 variant, a descendant of JN1. Early data from Pfizer and Moderna suggests that a shift to another JN1 offshoot, LP81, currently dominant in the US, may offer broader protection, including against NB.1.8.1. A final decision on which strain to target in this fall's vaccine is expected in the coming weeks. In the meantime, public health officials continued to recommend basic preventative measures, including masking in crowded spaces and staying home when sick, which at least in my area, maybe 1 in 1,000 people actually do, so no one is even doing that anymore, as the country heads into its typical summer COVID-19 surge window, which should not be a thing and which makes life for all of us way more dangerous than it needs to be. Alright, so let's delve in more detail to this RFK Jr. ending the coronavirus shot recommendation for healthy children and pregnant women. Currently, it's recommended for all people over 6 months. They're trying to change that. This is a Washington Post article from the 27th. Health and Human Services Secretary Robert F. Kennedy Jr., anti-science, anti-vaccine fanatic, announced Tuesday that his agency would no longer recommend the coronavirus vaccine for healthy pregnant women and healthy children, a rare move that bypasses the traditional system of vaccine recommendations from the CDC. In a 58-second video posted on Twitter, Kennedy said that the vaccine had been removed from the CDC's immunization schedule for those two groups of people. Quote, "I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. Last year, the Biden administration and governments around the world urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children." So, first of all, it's not a fucking booster. That's how ignorant this guy is. It's not a booster. Boosters are when you get the same shot again. These are reformulated shots to try to cope with the mutations that have occurred in the virus. Secondly, the lack of any clinical data to support this is ridiculous. He's just flat out lying. And as to the basic safety of these shots, there have been studies on those too, as well as hundreds of millions of them that have been administered globally in the last 4 years. Continuing, currently, the CDC, which incidentally still doesn't have a confirmed new head, recommends everyone 6 months and older receive the coronavirus vaccine annually. And commenting, like I said earlier, that's not really enough to give you year-round protection because it does wane drastically after about 3 months. So if you were to get the shot in, for example, October, to cover yourself during the November, December, January holiday season when everybody's breathing indoor air and when bodies and immune systems are under increased stress from colder temperatures, typically resulting in the annual spike in cases on New Year's. That is, something that would protect you somewhat, but by spring, that coverage would have dropped way off. So again, it's just not enough in my opinion for your main strategy. It's a good plan B in case of a mask fail, but the mask is really your safest bet. Continuing, Kennedy, the founder of a prominent anti-vaccine group, has a lengthy history of disparaging vaccines. He has targeted the coronavirus shot in recent years, falsely calling it the, quote, deadliest vaccine ever made. Complete horseshit. Kennedy has countered that he is simply seeking good data about vaccines before recommending any. Kennedy was flanked in the video by FDA Commissioner Marty Makary and Jay Bhattacharya, head of the National Institutes of Health. The social media post did not offer a detailed explanation about the move. Quote, "There's no evidence healthy kids need it today, and most countries have stopped recommending it for children," Makary said. Quote, "We're now one step closer to realizing President Trump's promise to make America healthy again," Kennedy said. Comment, "Wouldn't universal health care be part of making people healthy again?" Continuing, George C. Benjamin, longtime executive director of the American Public Health Association, or APHA, said the administration had been telegraphing this move for some time, but he asked about the data to support the conclusion that those vaccines might pose health risks for those populations. Quote, "Are they making this decision without going to any of their advisory committees?" Benjamin said. "Show us the evidence, the studies that have been done. I don't know of any." It's the head of the APHA. Last week, the FDA released a framework for narrowing its approval for updated coronavirus vaccines to adults 65 and older and people with at least one health condition that puts them at high risk, not at some risk, but just high risk for severe disease. The move marked a significant shift in the agency's approach to greenlighting the annual shots traditionally offered in the fall. The CDC has said pregnant women are more likely to get very sick from the coronavirus and are at increased risk of pregnancy complications, including preterm birth and stillbirth. And we're going to read an article about COVID and pregnancy right after this. The CDC estimates that 13% of eligible children and 14.4% of eligible pregnant women received the latest version of the coronavirus vaccine. So, commenting, when I said that they were continuing a trend which began under Biden, this is what I'm talking about. Barely anyone's getting the updated shots, and even that's too much for them. They want to take that away. The move bypassed the traditional process. Once a vaccine is approved or authorized by the FDA, the CDC's Independent Vaccine Advisory Panel holds hearings to determine who should receive the vaccine, when, and how often. The panel, the Advisory Committee on Immunization Practices, sends its recommendations to the CDC director. Once the director signs off, the recommendations become official policy, and insurance companies are required to cover the vaccines with no out-of-pocket costs to consumers. Richard Hughes IV, who teaches vaccine law at George Washington University Law School, said he cannot recall a previous time when an HHS secretary overruled the advisory committee and the CDC. Well, maybe just none of them were fanatical enough. But as I said, the CDC did push back. So here's an article. The CDC opposes RFK Jr.'s COVID vaccine guidance, saying children may receive their shots. So this is also from last week. Quote, "Shared clinical decision-making vaccinations are individually based and informed by a decision process between the healthcare provider and the patient or parent or guardian," states the CDC. Quote, "Where the parent presents with a desire for their child to be vaccinated, children 6 months and older may receive COVID-19 vaccination, informed by the clinical judgment of a healthcare provider and personal preference and circumstances," unquote. This means that health insurance providers will still be required to cover the COVID-19 vaccinations for kids in this age group. According to the New York Times, this also means that the shots will continue to be available to the 38 million low-income children under the Vaccines for Children program. But what about pregnant people? According to the New York Times, the CDC's official position is, quote, "no guidance." This contradicts a still live CDC webpage, updated September 10, 2024, stating that pregnant people are at increased risk for COVID-19 and resulting complications such as preterm birth or stillbirth. That same webpage also states that COVID-19 vaccination during pregnancy is safe and effective, and that these vaccines are not associated with fertility problems in women or men. This is clearly the direction they're trying to take things in, though. Here's another article, headline, HHS axes Moderna's $590 million pandemic bird flu vaccine contract, ending funding for late-phase trials. This is also from recently, just May 29. Bird flu has been continuing to circulate both on farms and among wild birds and other animals. It hasn't made the jump to being able to spread in human-to-human transmission, although humans can catch it through direct contact with infected animals. If it were to mutate to be capable of human-to-human transmission, it would probably make the COVID-19 pandemic look like nothing. So this is definitely a safety measure that would be worth developing. The article explains that Moderna won the contract at the back end of the Biden administration, and they have been conducting trials on it, finding that the vaccine was generally well tolerated according to Moderna, with no dose-limiting tolerability concerns. Most of the solicited adverse reactions were mild, being classified in grade 1 or 2, and didn't rise significantly between the first and second doses. but the funding that got pulled is basically cutting the budget for late-phase trials. This should really come as no surprise, as they've been cutting all kinds of science and medical funding, including funding for cancer research, thereby undermining one of the main selling points of the U.S. medical system such as it is. It's very unequal and unaffordable for the average person, but they say if you're rich, you can get the best care in the world, you just have to pay for it, but now they're even cutting the research, so I don't know what the future of this is going to be. And I don't know if they know either, because it looks like ChatGPT is kind of running the HHS. As we can see in this article, the MAHA report, Make America Healthy Again, cites studies that don't exist. The Trump administration's Make America Healthy Again report misinterprets some studies and cites others that don't exist, according to the listed authors. RFK Jr. says that the study harnesses, quote, gold standard science and cites more than 500 studies. According to this article, though, the citations are rife with errors, from broken links to misstated conclusions. 7 of the cited sources don't appear to exist at all. Epidemiologist Catherine Keyes is listed in the MAHA report as the first author of a study on anxiety in adolescents. When Notice reached out to her this week, she was surprised to hear of the citation. She does study mental health and substance use, but she didn't write that paper. Quote, the paper cited is not a real paper that I or my colleagues were involved with, Keyes told Notice via email. We've certainly done research on that topic, but did not publish a paper in JAMA Pediatrics on this topic with that co-author group or with that title, unquote. DHHS did not respond to a request for comment on the report's citation inconsistencies, and there are other examples. One is psychiatric researcher Robert L. Feindling, who was cited in the paper as having written a 2009 paper on direct-to-consumer advertising of psychotropic medications for youth. He says that he never authored that paper. And then there's another paper citing an MB Shaw, but MB Shaw doesn't seem to be an ADHD researcher. Another section of the report claims that 25 to 40% of mild cases of asthma are overprescribed, that kids are taking too much medicine, but the main citation to support that claim appears not to really exist. A pediatric pulmonologist named Harold J. Farber is listed as the author, but he said he didn't write it, and he never worked with the other listed authors. He said that he has written similar papers, but that the findings of those papers do not support the conclusions stated. Another example is in a section about mental health medication. The MAHA report says that there's a review paper stating that therapy alone is as or more effective than psychiatric medicine. But according to this article, one of that paper's statisticians, who Notice contacted, said that that conclusion doesn't make sense, given that the study they wrote didn't even attempt to measure or compare therapy's effectiveness as a mental health treatment. Quote, we did not include psychotherapy in our review. We only compared the effectiveness of new generation antidepressants against each other and against placebo. So the report is riddled with all kinds of made-up information and conclusions which are not supported by the evidence cited for them, and you would have major problems if you were to hand in this kind of thing in a research program. And again, these particular types of errors are typical when AI is used to write a report like this. Looking forward to more findings on that soon. As to the actual health risks to pregnant women and children from COVID and why you would want to protect against that, we'll look at 2 things quickly before moving on to general health risks of COVID. Here's an article, COVID pregnancies may have boosted autism risk, UCLA study shows. This was originally published in Bloomberg. It reads, as COVID swept across California in early 2020, pediatric infectious diseases physician Karen Nielsen grew alarmed by the crisis erupting in maternity wards. Pregnant women were placed on life support, undergoing emergency C-sections as the virus triggered severe complications. Some died. Nielsen had just finished a research project on how the emerging infectious disease Zika was causing severe birth defects. Concerned that the new coronavirus might have a similar impact, she began recruiting expectant mothers who tested positive for a new study. Soon after the study's participants began giving birth, Nielsen's colleagues at UCLA's Mattel Children's Hospital noticed an unusual number of their newborns requiring intensive care. Nielsen recalls another doctor stopping her to ask, "What's wrong with the babies in your study?" Sure enough, when researchers analyzed videos of the children lying on their backs in what's called the General Movement Assessment, 14% of the infants showed signs of developmental problems. The test evaluates early motor functions and is often used to assess the risk of neurodevelopmental disorders, including cerebral palsy. Later, during in-clinic assessments, the findings proved equally troubling. At 6 to 8 months old, 13 of 109 infants born to infected mothers, almost 12%, had failed to reach developmental milestones. In stark contrast, all infants in a control group born before the pandemic showed normal development. As additional participants from LA and Rio were enrolled, more unsettling results emerged. Around 11.6% of toddlers born to mothers with lab-confirmed SARS-2 infection during pregnancy showed cognitive, motor, or language problems indicative of neurodevelopmental delays. By comparison, only 2 of 128 unexposed controls, or 1.6%, showed such issues. Then, at 28 months, the study found 23 of 211 children, or again about the same number, 11%, screened positive for autism spectrum disorder. The expected prevalence, though, is 1 to 2%. Nielsen says, quote, "There's something really going on. We don't want to alarm the world, but that's what the data are showing." So they make the point that this is still in the process of peer review, and it's kind of more of a pilot study due to the small sample size of about 250, but because there are theoretical explanations of how this could happen, it is worth follow-up study. Again, there's the example of the mosquito-borne Zika virus known for causing cerebral palsy and microcephaly. And then there's other infections like rubella and certain herpes viruses, which can harm a developing fetus directly and result in hearing loss, cerebral palsy, and autism. It's also noted that the World Health Organization in 2021 confirmed that COVID could cross the placental barrier, as can rubella and Zika just mentioned. Some researchers believe that the damage stems from inflammation triggered by the virus or viral components crossing the placenta. There are other possible pathways for harm to the fetus as well. David Schwartz, an Atlanta-based epidemiologist and perinatal pathologist, led an investigation which found that on average, more than 3/4 of the tissue in infected placentas had been damaged, cutting off oxygen and nutrients essential for fetal survival. Alarmingly, this damage could occur silently even in mothers without acute, or basically having mild COVID symptoms, offering no warning signs. Quote, "We've never seen anything like this with an infectious disease. So far, I feel very confident in saying that this is unique to this virus." That's quoting David Schwartz. Nielsen also adds that she suspects that maternal immune activation might explain the high rates of neurodevelopmental delays observed among the infants in her study. Among at least 4 toddlers with severe delays, blood tests taken at birth revealed biomarkers showing that the brain's immune cells were attacking neurons. Quote, "When you see microglial activation and neuronal signaling pathways traditionally associated with autism showing up in this cohort, it suggests there's something behind it," unquote. So again, they're still working on this research, but that is something that we want to keep an eye on. And again, the idea that pregnant women or young children can't be harmed by this virus and shouldn't get vaccinated is just incorrect. Here's another one that we've been covering for quite a while, years now on the channel. COVID greatly increases diabetes risk in kids and teens. This is by Lisa O'Mary for WebMD, October 2024. As the nation searches for ways to reduce the number of young people diagnosed with type 2 diabetes, a new prevention pathway is emerging, avoiding COVID-19. Teens and adolescents were much more likely to be newly diagnosed with type 2 diabetes within 6 months of having COVID-19 compared to kids of the same age who were diagnosed with other respiratory infections. So this is not just the flu, this is a serious virus which can, again, attack all of your major organs, including in this case the pancreas. I know from previous studies that we have covered in past COVID updates, it's believed that direct damage to the pancreas is the cause. So it's the virus getting into your body and messing up your heart and lungs and kidneys and pancreas. This particular article is talking about type 2 diabetes, but we know from earlier studies also the risk of type 1 diabetes goes up. And again, this is particularly in younger people. And note, most people in the study were not sick enough to be hospitalized. Overall, 14,000 who were diagnosed with COVID were hospitalized, and they had a 3-fold increase in type 2 diabetes risk compared to the more than 22,000 who were hospitalized with other respiratory infections. So, in this study, total 36,000 people were hospitalized with some kind of infection. 14,000 COVID, 22,000 something not COVID. And the people who were hospitalized with COVID had a 3-fold increase in type 2 diabetes risk compared to the other group. This is not something you want to mess around with. Quoting the lead study author, this is a huge spike. If a child is getting diagnosed with diabetes, they have a long life to carry that chronic disease. A lot of years ahead of them that they have to deal with that. And while we're covering well-established consequences of COVID, here's another article, Even Mild COVID-19 Can Shrink the Brain, Preliminary Research Finds. This is published in 2021, so we have known this for quite some time. It resembles brain changes seen in older adults. In this study that they're talking about in the article, researchers relied on an existing database called the UK Biobank, which contains brain imaging data from over 45,000 people in the UK going back to 2014. So crucially, there's baseline data and brain images of all these people from before the pandemic. The research team analyzed the brain imaging data and then brought back those who had been diagnosed with COVID-19 for additional brain scans to compare. The team found marked differences in gray matter, which is made up of the cell bodies of neurons that process information in the brain, between those who had been infected with COVID and those who had not. Specifically, the thickness of the gray matter tissue in brain regions known as the frontal and temporal lobes was reduced in the COVID-19 group, differing from the typical patterns seen in the group that hadn't experienced COVID-19. In the general population, it's normal to see some change in gray matter volume or thickness over time as people age, but the changes were larger than normal in those who had been infected with COVID-19. And importantly, when they separated the individuals who had severe enough illness to require hospitalization, the results were the same as for those who had not been hospitalized. So people who had been infected with COVID-19 showed a loss of brain volume even when their COVID was not severe enough to have required hospitalization. They also conducted testing on performance on cognitive tasks and found that those who had contracted COVID-19 were slower in processing information relative to those who had not had COVID. So tell me, do you think it's advisable to get 4, 5, 6, 7 COVID infections? What do you think that's doing to your brain? Let's also talk about the loss of taste and smell, which is a well-known symptom. Not everybody gets it, but a lot of people do. That's a sign of brain damage because this is linked to the olfactory bulb, a structure near the front of the brain that passes signals about smells from the nose to other parts of the brain. And there's a possible connection here from Alzheimer's research, where some data have suggested that those at risk for Alzheimer's have a reduced sense of smell. So whether the COVID-induced loss of smell is connected was not clear at the time of this article 4 years ago, but in subsequent COVID updates in the interim, we've in fact covered studies linking COVID with increased risk of dementia from Alzheimer's and Parkinson's disease. So again, for all the people out there like, oh, it's extreme, don't live in fear, blah, 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 I don't want brain damage from a preventable, communicable illness. That does not heal. That does not go away. I probably have a lot of years left in my life, and I want to enjoy my brain at full capacity, not diminished capacity. And in addition to not going away, it may actually keep getting worse with time. This article from the Wall Street Journal, titled, Is COVID Rewriting the Rules of Aging? Brain Decline Alarms Doctors, states millions of long COVID patients continue to struggle with cognitive difficulties, and it includes a case study, a guy named Todd, 56-year-old, who says he stopped working in 2023. When he tried to apply for jobs, he realized he just didn't have the physical or mental stamina. Quote, it just exacerbated my symptoms, unquote. Later in the article, they talk about a study published in the Archives of Physical Medicine and Rehabilitation that found that after cognitive rehabilitation, about half of patients reported some kind of improvement, but about 1/3 of the 70 patients didn't have a significant difference in objective measures of memory after the cognitive rehabilitation. And then if you keep getting infected, what then? So we mentioned the immune system also. Here's an article, In Patients with Long COVID, Immune Cells Don't Follow the Rules. This is by Sarah Williams for Gladstone Institute's January 2024. It reads, people with long COVID have dysfunctional immune cells that show signs of chronic inflammation and faulty movement into organs, among other unusual activity, according to a new study by scientists at Gladstone Institutes and UC San Francisco. The team analyzed immune cells and hundreds of different immune molecules in the blood of 43 people with and without long COVID. They delved particularly deep into the characteristics of each person's T cells, immune cells that help fight viral infections but can also trigger chronic inflammatory diseases. Their findings, which appear in Nature Immunology, support the hypothesis that long COVID may involve a low-level viral persistence. Basically, the virus is still hanging out in your body at low levels and your body just cannot knock it out. The study also reveals a mismatch between the activity of T cells and other components of the immune system in people with long COVID. So in other words, in people with long COVID, the activity of T cells is disproportionate and disharmonious with the other components of the immune system. So they're acting out of balance. The researchers note that long COVID is not just one thing. The longer-term negative outcomes of COVID can vary from person to person, and, quote, not every person with long COVID had pro-inflammatory cells known as CD4 T cells, which are responsible for the overall coordination of immune responses, which in some of the people with long COVID are in a more inflammatory state. But we only saw them in the long COVID group. So not everybody with long COVID has it, but only people with long COVID have it. So continuing the quote, it underscores the idea that there isn't just one uniform thing that characterizes all individuals with long COVID. In a different subset of T cells known as CD8 T cells, which normally kill cells that are infected by viruses or bacteria, the researchers observed signs of exhaustion preferentially in people with long COVID. These signs, interestingly, were observed only in T cells that recognize the SARS coronavirus 2 virus, not in the broader population of CD8 T cells. Quote, such exhaustion is typically seen in chronic viral infections such as HIV, and it means that the T cell branch of the immune system stops responding to a virus and no longer kills infected cells. This finding fits with some hypotheses that long COVID, or at least some cases of it, are caused by persistent infections by the SARS coronavirus 2 virus, unquote. And so we read a study, I don't know when, but some time back on a previous update, where researchers out of Boston were looking for a biomarker, something measurable in the blood in people with long COVID, and they found that about 60% of them, so a majority but not all, had the spike protein, evidence of an ongoing, lingering infection, which the body just could not shake. And again, that's 60% of people. What's going on in the other 40? There's a lot of different pathways to getting something that we refer to as long COVID. But anyway, these CD8 T cells that are touched by COVID exhibiting the exhaustion, again mimicking the kinds of outcomes that you see from HIV, not a good thing. I mean, that's not going to enhance your lifespan, let's put it that way. Currently, this is just being studied. There isn't a treatment for it. So really, the only safe move is don't get COVID. That's the only way you can really be sure that you're not going to get long COVID. Don't get short COVID. In other words, don't get infected at all. I believe that the current official rate of long COVID is 8% of people who get infected with COVID. So really not good odds, 1 in 12. That's decent chance of getting some of these longer term complications. And if you get hospitalized, if your COVID is severe enough that you get hospitalized, then your odds of getting long COVID go way up to like 50, 60%. So really you're more likely than not at that point to get long COVID. Also, interestingly, one of the other things that the researchers found was that in people with long COVID, levels of antibodies against SARS coronavirus 2 are unusually high, and they don't synchronize as they usually do with levels of T cells that fight the virus. Quote, this finding points to the notion that during long COVID, you have a breakdown in coordination between different arms of the immune system, unquote. And they conclude by saying they're really just investigating this at this point. They're not really at the stage of even thinking about what the treatment will be. So if you do come down with this, it could be years and years before there's a treatment. So don't get it. Finally, I want to share an article from about a month ago from CIDRAP, Center for Infectious Disease Research and Policy at the University of Minnesota. Headline, Studies Detail High Rates of Long COVID Among Healthcare and Dental Workers. Remember that at the dentist's office, people are unmasked in order to receive care. In other words, you really can't get a dental cleaning or checkup while wearing a mask because you just can't see your mouth. However, there is one workaround some people use. There's a kind of stick-on mask called a ready mask with an eye, which technically if you stick it on your upper lip and around your nose, you could breathe through your nose if your nose is clear during a dental exam, although, kind of iffy. And again, at other healthcare providers' offices, a lot of times there will be some kind of oral exam during which patients will be unmasked, and it's very hard to avoid that, although I would just like to take another moment to complain publicly about the overall awful response that many medical providers have demonstrated during this public health emergency and not taking masking or really any other precautions, ventilation, disinfecting the air seriously. Anyway, getting into the article, researchers have estimated that approximately 8% of Americans have ever experienced long COVID or lasting symptoms following an acute COVID-19 infection. Now, 2 recent international studies suggest that the percentage is much higher among healthcare workers and dental professionals. There's a 40% prevalence in health workers globally. The authors of the study defined long COVID as prolonged symptoms and/or functional disability following SARS coronavirus 2 infection for at least 4 weeks from the onset of symptoms or from time of diagnosis in people when SARS coronavirus 2 infection was self-reported, clinically diagnosed, and/or diagnosed through a laboratory test. All studies were conducted before February 2022. During an average follow-up of 22 weeks, the pooled prevalence of long COVID among healthcare workers who had SARS coronavirus 2 infection was 40%. In 3 studies with follow-up after 12 months, pooled prevalence dropped to 26%, still pretty high. The most common symptoms reported were fatigue, neurological symptoms, loss or decrease of smell and taste, muscle aches, and shortness of breath. Then there's a second study which says that dental workers are also at risk. Quote, individuals with long COVID symptoms were more often dental assistants, long COVID 48.5% versus no long COVID 29.2%, or dental hygienists, 15.2% versus 8%, than dentists, 36.4% versus 62.8%, the authors wrote. Similar to the first study, the most common symptoms were exhaustion, fatigue, and lack of concentration, and overall, vaccination seemed to be protective against long COVID in this study, so it reduced the odds of getting long COVID or protected people from getting it as much. And that's something that we've seen in other studies too, that vaccination reduces your odds of getting long COVID if you do get infected, but it does not reduce them all the way to 0. In other words, you still have some chance of getting long COVID even if you're vaccinated, but your odds of not getting it will be better than if you had not been vaccinated. Quote, we observed a 10% difference in the incidence of long COVID between vaccinated and non-vaccinated dental team members. So we're going to leave it there for now. This has been your COVID update, and I will include links to all of these articles in the video description. What do you think? Leave a question or comment below, and we will continue the discussion there as always. Otherwise, thanks for listening, and thanks to the current patrons and Buy Me a Coffee supporters whose names are on the screen. If you'd like to get your name on the screen, head to patreon.com/socialismforall or buymeacoffee.com/socialismforall. Every donation is encouraging, they're also materially helpful, and they allow me to spend a lot more time on this channel than I'd be able to do without them. This channel is completely viewer supported. We don't run ads or do sponsorships, so if you like this channel, thank me, but also thank a patron or Buy Me a Coffee supporter, and consider becoming one yourself. Beyond that, engagement counts, so like, share, subscribe, and we will see you in the next video.